You're listening to the Doctor Is In podcast, brought to you by martinclinic.com. During the episode, the doctors share a lot of information. As awesome as the info may be, it is not intended to diagnose, cure, treat, or prevent any disease. It's strictly for informational purposes.
Well, good afternoon. I want to talk to you this afternoon about another big problem in society today, something that you're hearing more and more about. And that is the condition of Lyme's disease. Now, I first heard about Lyme's probably in the 1980s, early 1990s. People, especially in a certain part of the United States, more in the eastern seaboard and in the areas of Connecticut and New England, they seem to have started there, and they thought it started with the deer population, that the deer population in that area had been infected by a tick, and they named it Lyme's. It's a spirochete. And so we've been hearing, that was very rare. It seemed to be in one area, and now has become worldwide. And, even in Northern Ontario, where I practice, there's a lot of Lyme's disease. It's become quite common. And I just want to talk to you today about a couple of things. One is some of the misconceptions. First of all, Lyme's disease is not an easy diagnosis. There's very few tests that you can do that specifically says, hey, I have Lyme's disease. Now, there are a few, but even then, they're not always accurate. And one of the interesting things is, because if you go online and you look at, say, well, generally it will start with a bullseye rash. You can actually see a rash. But do you know that 70% of the people that get Lyme's disorder do not have any rash at all? They don't remember getting a spider bite or a tick that they could see at least. Some do, but a lot, and actually the vast majority of people never see the actual bite, or they don't get a rash. And if they do get a rash, it's not necessarily the bullseye rash, okay, which is, which you will look on. If you Google Lyme's disease, you'll see a rash, and I've seen that rash, by the way, but it's not everyone. So that's one of the misconceptions. The other thing is that Lyme's is always difficult to diagnose because it mimics so many other disorders. I mean, if people come in and display, for example, severe fatigue, the immune system has been compromised, they're recurrently, they're getting sick all the time, they don't feel good, very low energy, lethargic, joint pain a lot of times. Well, that, a lot of doctors are thinking, they're going to check your blood work, they're going to do tests, they're going to see if you have an autoimmune disorder, because those symptoms can mimic MS, they can mimic rheumatoid arthritis, they can mimic lupus and a lot of other disorders. And doctors, they're trained to think in that way, to think of some of the things that it could be. And oftentimes they're not thinking of Lyme's, and they're not looking at Lyme's unless they see a rash, or the patient presents themselves and saying, well, look, I had a rash or whatever, and then ever since then I got sick. The problem now is where this disorder has become worldwide, we believe at least, that it's been, really spread by migratory birds that are just, they travel the North America, they travel the planet, and so these disorders have rapidly spread. So those are some of the possible symptoms. There are many symptoms, but the big ones are suppressed immune system, exhaustion, joint pain, cognitive, where their brain feels like it's working like mush. It's just not, they can't focus, they can't concentrate, and different issues like that. So let me get to this now, what to do. if you are suspicious that you have Lyme's, or I always say in the office, Lyme's like it doesn't have to be diagnosed as Lyme's per se for you to be proactive in treatment, because the treatment for Lyme's is, I mean, generally, and I'm not against this, by the way, if you have specifically, and you know for sure you have Lyme's, it's not a bad idea to get an antibiotic treatment. And most doctors will know exactly what to do in terms of the antibiotic. But let me just say this. One is that antibiotics, if they are used for Lyme's, and like I said, I'm not against it, need to be very, very temporary. Like you're never doing more than 3 or 4 weeks of antibiotics at the most. And so, to kill the actual tick, the bacterial tick, then you use, I'm not against the use of antibiotics, but generally here's what the Martin Clinic protocol is for the treatment of Lyme's or Lyme's-like, because you might have a parasite and it's not necessarily a bacterial parasite. It might very well be, but generally you want to do a few things to really help your body to fight this disorder. Number one on the hit parade to fight Lyme's is you must use a broad spectrum probiotic. The reason is because there's certain bacteria in the broad spectrum probiotics, especially like L. rhamnosus, L. reuteri, and other ones that are very, very targeted probiotics that go after Lyme's and Lyme-like parasites, spirochetes. And you need to have a broad spectrum. What do I mean by that? That your probiotic must have at least 10 different strains, and make sure it has L. reuteri and L. rhamnosus, because they're very, very specific to fight a parasitic spirochete like Lyme's or anything like it. It could be in the family and you're never going to get it diagnosed. You almost have to self-diagnose it. Secondly, you want to go on a high dose temporarily of vitamin D. What vitamin D does is vitamin D activates your T cells, your lymphatic system, Navy SEALs of your white blood cells to go after the particular tick. And so I highly recommend that people go on high doses of vitamin D temporarily for, maybe 4 weeks, do somewhere around 20,000 IUs of vitamin D. And that can be brought down as you go along. But you want to stimulate the immune system to really turn on this particular bacteria. The other thing that you want to do is use oil of oregano. Now, oil of oregano should be used, I like it in spray, but you might use it in drops. And if you can't handle the drops, then take it in capsules. But we love oil of oregano, and the reason is, and we put it in our digestive enzymes because it's very good to fight SIBO, which is another bacterial infection that attacks the small intestine. But you want to use oil of oregano, and you want to use it aggressively. So a good way to do it is to take out a toothbrush, put a couple of drops of oil of oregano or oil of oregano spray. You're going to brush your teeth anyways, put the toothpaste over it, and then brush your teeth vigorously 2 to 3 times a day. And if not, if you can take the drops, put it right in your mouth. I like the oil of oregano spray. I can spray the back of my throat with it. I call it spray and pray, because you're going to need to pray because it's strong. For 5 seconds, it's going to burn big time. So spray and pray or whatever. You can put a few drops in water too and just take it. But do it several times a day. It is very anti-parasitic. It's very antibacterial. It is very antiviral. So there's nothing like oil of oregano in terms of a natural antibiotic. I believe it's number one on the hit parade in terms of natural antibiotics. The other thing that we do is I try, because what happens to two things I want to talk to you about. One, where does this parasite or tick or spirochete, where does it often attack? Two organs. One of them is your liver. Your liver is your oil filter. Your liver is the place where you detoxify the most. And you want to make sure that you keep your liver clean, because your liver is going to filter out of your bloodstream. Because remember, Lyme's gets into the bloodstream. It's not just in your tissue, it goes everywhere. It becomes systemic because it gets into your blood. And that's why you feel so unwell. Your blood's going to go through your liver. Make sure your liver is clean. No alcohol, okay? While you're fighting, no alcohol, no carbohydrates, because what carbs do is they load up the liver. Especially sugar. Sugar has to be stored in your liver, and your liver is like a suitcase, and you don't want it to be full of glycogen from sugars, because then your liver will not be able to detoxify the spirochetes that are in there. So the other thing to clean your liver is water, H2O, drink. If you're suspicious of Lyme's or Lyme-like disorder, water, water, water. The other thing that I like is in the detoxification process is make sure that your the other thing that I like is vitamin A, because vitamin A is really, really important for your immune system. And a lot of people don't realize they're low in vitamin A, because vitamin A is found in the animal kingdom. And a lot of people today, they don't eat enough eggs, meat, and cheese. So this is part of your diet. You want to get your levels of vitamin A up. You can take a vitamin A. We have a product in the office called Blood Boost. I often put my Lyme patients on it, because all of the vitamins in there are, and the minerals and the magnesium and all of the herbs and that I use, I pack it into chelated, all ready to be absorbed into your body, chelated vitamins and minerals. So if you look online, you'll see Blood Boost, okay? Now, the other thing that you want to do, again, I talked to you about your diet, clean it up. The other thing that it affects, so it affects your liver. The other organ that it really attacks is the adrenals. You see, the adrenals are like what you call fight or flight. So what happens in Lyme's is that your body goes into fight or flight. It's fighting an infection. So the adrenals, and look, your body is made to fight infection. It's normal. The problem is if that doesn't get turned off, if the infection is long-term, then your body, it starts to exhaust your immune system through not only your immune system, but your adrenal glands. Your adrenals are your battery packs. They're the things that affect your mitochondria, the little battery packs within your cells, and the ATP that comes out of there, the energy that comes out, that's the ATP. And I've noticed over the years that any chronic infection like that, once it becomes systemic, and that will attack the adrenals. And this is why it's so, the symptoms are so similar to those of chronic fatigue syndrome. And, you know, I've written many a book and many an article and many programs. I've talked about chronic fatigue syndrome, and all of the symptoms just about in Lyme's are very similar to chronic fatigue. Well, you get chronic fatigue with Lyme's because it attacks the adrenal glands, and the adrenal glands affect the mitochondria, and the mitochondria, which releases your ATP, you're exhausted. And so for the adrenals, I often put my patients on, it's part of affecting them and getting them regenerating their adrenals. I'll put them on our cortisol control, and I'll also put them on Navitol. Navitol is, the reason Navitol is so effective in fighting Lyme's is because it elevates your glutathione. And glutathione is like your master detoxer. Think of glutathione. Your body actually makes glutathione. But when you get real sick and you've been fighting an infection for a long period of time, your body doesn't produce near as much glutathione. And glutathione is like Velcro in your bloodstream. It's like those bacteria and viruses and candida and all that attach like Velcro to the glutathione. And the reason I like Navitol so much, even in immune disorders, is because it elevates naturally your glutathione levels. So those are sort of the protocol of what I talk about for people that have Lyme disorder. Okay. Now, so if you're not sure, if you have any questions or whatever, don't be shy to ask our staff. Thank you very much for watching today. If you know anyone that has Lyme's at all, would you pass this on to them and share it and give us feedback? Thank you very much.
You've reached the end of another Doctor is In podcast with your hosts, Dr. Martin Jr. and Sr. Be sure to catch our next episode, and thanks for listening.